Personal support worker Lisa Burke has always had a tough job, but now it's getting even harder.
Like, I feel like I'm dodging bullets at this point, just because of how many people are getting sick.
Over half of Ontario's long-term care homes are now in outbreak, and the number of workers in isolation is surging. More than 3,800 across Ontario off sick, adding to the chronic understaffing that's long been a problem in long-term care. The outbreaks mean residents again are being forced to spend long periods in isolation, confined to their rooms.
It's so distressing to me just to think of her sitting there in her wheelchair all day long by herself.
Michelle Van Bussecombe's parents have been in isolation for more than a week, initially kept apart from even each other with dozens of staph infections at their Brampton care home. Van Bussecombe is appealing to the local public health unit and the province to allow more family volunteers to fill in the gaps.
They could be coming in and doing that work, which gives residents some quality one-on-one time.
Staffing shortages cost lives in the pandemic's earlier waves, and advocates say the Ontario government has yet to learn its lessons. They're imploring the province to again call in the military.
To make sure that those conditions which happened before, where people died of neglect, they died of dehydration, they died of hunger, do not happen again.
As fourth doses are being rolled out to residents, the province is facing criticism for only requiring N95 masks for staff after a case is suspected.
We're there because we love what we do.
Despite her precautions, Burke worries about contracting COVID on the job and bringing it home to her young kids.
The thought of leaving my kids and not being able to be with them is hard too.
So much pressure on so few workers. Ellen Morrow, CBC News, Toronto.